Hi. Oh, thanks. Slide. I've got a slide. I've only got one, but it's a beauty. Right, what am I doing here? Right, that's... Right, hi. So I'm Cole Roberts. That's me there. And I'm a postdoc at the psychology department in the University of Liverpool. Yeah, so basically we've been asked to say what are we doing and what we wanted to get out of coming here. So that's why I've written, what am I doing here? Although that is, what am I doing? It's a question I tend to ask myself constantly, to be honest with you. So I am a psychopharmacologist, and I'm interested in how drugs affect the brain and behaviour, and that's why I've put a terribly pixelated image of the icon for the Research Centre for the Brain and Behaviour there. So currently I am working on a clinical trial looking at how the SGLT2 inhibitor dapagliflozin affects appetite and eating behaviour. So basically this is a collaboration between our psychology, appetite and obesity research group and the obesity and endocrinology group in Aintree University Hospital, which is an EASO-COM. As you know, type 2 diabetes is a chronic disease characterized by hyperglycemia, and a lot of the kind of drugs available for treatment of it are kind of like, don't halt the progression of disease, and a lot of them, especially ones with insulin-dependent mode of action, tend to exacerbate weight gain, which is kind of problematic given that obesity is a risk factor for type 2 diabetes. So they're always on the lookout for new drugs, and these SGLT2 inhibitors are a new drug in this area. So how they work is they block reabsorption of glucose in the proximal renal tubule, resulting in glycosuria. So basically it means that you'll reduce the glucose by, you piss it all away. This results in reduced hemoglobin and reduced glycated hemoglobin levels, which means that it's an effective drug. And also in all of the trials with this drug so far that you've seen, weight loss. So the predictive weight loss per day with dapagliflozin is like 300 calories a day is how much that you're meant to kind of like pass in the urine. So over a 24-week period, then if there was no change in energy balance, then you would expect a weight loss of about 6.7 kilograms. But the clinical data so far saying that there's actually about half of that happening. So this trial is basically trying to see why that is. So we're investigating mechanisms, underlying changes in energy balance, so that in the future it might be possible to develop interventions to optimize weight loss and therefore the therapeutic benefit of this agent. So the measures that we use, we're interested in all the mechanisms here that might alter energy balance. So we're interested especially in eating behavior, so how the drug affects eating behavior, and we use universal eating monitors. So here we can look at intake as well as things like eating rate, and we can look at within meal satiation. We look at between meal satiety throughout the day. We also see how the drug impacts your energy expenditure using calorimetry. And also we do fMRI. I've kind of like a neuroscience background, so I'm particularly interested in the fMRI stuff. So we kind of look at not only areas involved in appetite, such as like the hypothalamus and the insula, but also areas involved in reward and inhibitory control. So these provide a neurophysiological correlate of the behaviors that we're seeing when we're measuring the eating behavior. I think this is quite interesting because we can use these kind of techniques to look at pharmacotherapies for obesity. And if we look and investigate exactly the mechanisms by which that they produce their kind of effects, then we might be able to improve their tailoring potential to people with specific problems with their behavior. So why do I want to be here? Basically, I'm not from an appetite background. I did all of my PhD work in drugs, So I used to do neuroimaging on people that took like a shed load of pills and see what happened to them. So I'm kind of new to the research area, so I knew that there was like many contributing factors to the obesity problem, and I thought that this summer school may help me to kind of like get a greater understanding of the whole thing. And it's very complicated, isn't it? Also, I thought it would be nice to get out of the UK for a few days. Thanks.
Thank you very much.